It's great you want to make Victoria safer by becoming a prison officer. It's a rewarding and secure career that can lead to many different opportunities. The role can be demanding at times though, so it's vital all prison officers have the capability to carry out the tasks they may have to perform. This is why all candidates must pass a health assessment before they are formally offered the position. This video will walk you through each section of the health assessment. You will discover the basic medical and physical benchmarks you need to achieve to pass this stage. You will also learn some training tips that will help you get to the level you need to be at. If you progress to the verification check stage, you will be able to book your free health assessment at a medical clinic near you. You will attend the clinic and carry out a range of tests and exercises with a clinician. They will assess your body mass index, or BMI. Your BMI reading is calculated by dividing your weight in kilograms by your height in meters squared. Your BMI reading must be between 18.5 and 40. In some circumstances, applicants outside of this range may be considered when assessed in combination with other functional tests. There are online calculators you can use to do this for you. If you are too low or high for the range, it's worth considering what lifestyle factors could help you meet the benchmark in time for the assessment. Your blood pressure will also be taken. You must register a reading at or below 140/90. If you're not confident in your cardiovascular health, you should book an appointment with your GP. Prison officers must wear breathing apparatus equipment when responding to certain emergencies. This can strain a wearer's respiratory system. This is why your lung function will also be tested. A normal lung function level is enough to pass this section. A vision test will show if you meet the standards of better than 6/9 in your better eye and 6/18 in your weaker eye. Vision correction is required if you fall below the benchmark. An audiogram will test your hearing. You cannot have a hearing loss exceeding an average of 40 decibels. You can't perform work as a prison officer while under the influence of alcohol or drugs. So as a part of your assessment, you will provide a urine sample for testing. Your results must be negative for both alcohol and drugs. If you return a positive result and you suspect it's due to medication you have been prescribed, you can provide documentation to validate this. We also recommend you bring documentation from your GP that helps a clinician better understand any medical condition you may have. Next, you will move on to the physical capability section of the assessment. These tests attempt to simulate some of the tasks and duties that you may have to perform as a prison officer. In this section of the assessment, you will once again need to achieve basic benchmarks to pass. First up, push-ups. You will complete 15 consecutive push-ups. You will begin by lying face down on your stomach. It is acceptable to kneel while doing this task. Practicing a variety of push-ups, including wall and incline push-ups, should improve your core and upper body strength and help in passing this stage. Next, you will hold a front plank position with correct form for 60 seconds. To prepare, you could practice variations of a plank, including a front or side plank, ensuring you perform them with good technique. Then you will do the YMCA step test. Using a step that is 30 centimeters high, you will step up foot by foot, then step down foot by foot. You will do this in time with the beat and continue for 3 minutes. One minute after the exercise, your heart rate will be measured. It should be less than or equal to 110 beats per minute. Increasing your daily movement, like going on extended walks or jogs, is a great way to prepare for this task. Your grip strength will be tested using a dynamometer device. You will need to demonstrate a grip strength of at least 20 kilograms. If you're trying to improve your grip strength before the assessment, try some resistance training. Exercises like pull-ups can help a lot. Next, there will be a series of lifting exercises. You will lift a 20 kilogram weight from floor to waist height and repeat the motion 5 times. You will lift a 15 kilogram weight from waist height to shoulder height, again repeating this 5 times. You will be asked to lift 2 5 kilogram weights or dumbbells from shoulder height to above your head. You will perform 5 repetitions with 2 weights, 1 in each hand. You will carry a 20 kilo kettlebell in each hand for a total weight of 40 kilograms over a distance of 10 meters. You'll carry a 10 kilo weight by your side in one hand over a 10 meter distance. You will repeat this in the other hand. Consistent weight training, moving up to the benchmark weight, will set you up well to achieve the standards. Make sure you research safe lifting to prevent injury. Then it's on to leg work. You will perform a sustained full squat hold with correct form for 30 seconds. Squats target multiple muscle groups, but practicing wall sits and squats is great preparation. Finally, you will adopt a kneeling position and hold it for 30 seconds. As with so many of the exercises in the assessment, doing resistance training can be fantastic preparation. And that's it! If you've reached all the benchmarks, you could be a step closer to becoming a prison officer. Following your assessment, an occupational physician will make a fitness for duty determination. If more information is needed, we'll get in touch with you. Thank you for your interest in doing this essential work for Victoria. If you're confident you have what it takes to pass these tests and do a great job, apply now.